all these fluids with insulin stuff, and her sodium went up.
Why?
Because she's diabetic.
Oh, I never really got rounds on her.
That's okay. So, what we did with her is, I'm really added up, but if you look at her, what we had her on, fluids-wise, it didn't really make sense because she's 2 kgs, and we had her on an insulin CRI plus fluids, and the insulin CRI starts at 10 mils an hour.
And wasn't she anemic too?
Yes.
So that's not good, right?
Well, I mean, correct, but I'm just saying that with her fluid requirements. So if you look at, so we talk about like what fluid maintenance needs are, and so typically there's a whole bunch of different formulas about there. And the reason I want to bring this up is because I've seen some of the doctors say to you guys, "Oh, let's just start them on maintenance or twice maintenance." They don't give you guys a number. Have you ever had that happen?
Mm-hmm.
I'm trying to get that to not be the case, not because I don't trust you guys, but there's so many different formulas that I don't
Well,
want.
isn't maintenance 1 mil per pound?
You can use that, I know.
Well, is there more than that?
There's tons of formulas, yeah. So typically we use, I mean, the most credible one is 60 mils per kg per day. And so that would, then if you divide it by 24, if you divide that by 24, so let's say like a 10 kg dog, let's just say,
2.5.
Right, so that'd be 2.5 mils. That would, so 2.5 mils per kg or 1 mil per pound is fine. I mean, it's the same, right? And so they're it depends also, it depends on how big the animal is too. And so the formulas, anyway, yes, 2 mils, 1 mil per pound or 2 mils per kilogram per hour is totally fine. So if you look at Zoe, Jane, she's 2.2 kgs, okay?
Mm-hmm.
So her maintenance would be what?
Like
Let's say
5 mils or 5 mils an hour.
Okay, so let's say 5 mils an hour. Now, what are we giving them? What is this based on? Like, what is? I'm not quizzing you, but you're my person.
No, I like it.
So why? So 60. You said this is their maintenance. What is this? What does this number account for? There's 5 mils an hour of fluids. What is that replacing?
Like ongoing losses?
Okay. It's basic. It wouldn't say ongoing. It's basic needs of the body. So
Oh, yeah.
maintenance means assuming that an animal is not drinking, but it's otherwise normal, like everything else is normal.
Mm-hmm.
So to make up for what you need for respiration, and hydration.
Yeah, and like urine.
Well,
Output.
ultimately, right. Well, it ultimately becomes urine, but in terms of basic requirements for the body. So there's a lot of, the reason you drink a lot of water is because you need water. Many of the reactions in the body require water,
Mm-hmm.
your hydration reactions. And so this is basic. This is this dog's just basic metabolic needs.
Yes.
Okay? And it's the same, so the same formula, by the way, is there. Yeah, and it's whether you give this if by orally or you give it IV, it's the same. So let's say that. So then we said that she was also on. So she was on, let's just say 5 mils an hour. So she was also dehydrated. And so let's just if we add her dehydration, let's just say that she was. Let's say she's 5% dehydrated. Okay.
Okay.
So let's add up. Let's just add it up. I'll show you what the error of my was. So she's 5. So it's 2.2 gigs, whatever. So to 5 mils an hour. Then I'm going to say plus. So we have a dog that's 5%. Let's say 5% dehydrated.
Mm-hmm.
So do you know how we need to convert that into mils? Let's say 2.2 kigs. Okay, she's 5% dehydrated. So what's 5 times 0.05?
2.25.
Right. Okay. Well, so she's 2.25. That's 200. 2.25. Hang on. 2.2 times 0. Yeah, is that right?
Oh, wait, hang on. 2.25. Wait, 2.5.
2.2 times 0.05.
keep getting different answers every time. 0.11.
There you go. So equals 0.11 kilograms, right? Okay, which is the same thing since 1 kilogram is 1 liter. So 1
Okay,
liter
yeah.
of water, that is 0.11 liters or 110 mils, right?
Mm-hmm.
And so what divide that by, so that's per day, so what would that be per hour?
55.
What would be 110 divided by 24?
Oh, 4.5. Why do I
Okay.
keep getting different?
That's okay. So now we have this dog who has 2.2 kgs. It's already on 5 mils an hour, right? Plus, what did we just get? How much?
4.5.
Okay, so then 4.5 mils an hour. Oops. Okay, so this dog is already on 9.5 mils an hour, right?
Mm-hmm.
Okay, so it's not too bad. But then there are other. Then what else was this dog on? If I look at, I will say it was also on Unison, and let's just you can just say Unison. So if she's on, so then we had her on an insulin steroid, which we'll do. But if it's a Unison, I don't know if this is interesting. So we know that the dose of Unison, it's 30 mg per mil, right?
Mm-hmm.
And so let's just say 25 mils per kg. So what does that come out to be? So 2.2 times 25.
55 divided by 30.
Yeah.
1.8.
Is that about right? That's like
Yeah.
what you okay, so then figure that's 1.8 mils I think you know an hour. Then the other drug would be, let's say metronidazole.
Okay.
Okay, so let's just say 10 mg per kg. So 10 mg per kg of metronidazole.
Is that 5 mg per mil?
Yeah.
4.4.
That, okay, so it's not that much because it usually
So
So
I did 10 times 2.2,
yeah.
which is 22,
Mm-hmm.
divided by divided by 5.
Yep.
4.4.
Okay, so that's 4.4 you said,
Mm-hmm.
and we give that 3 times a day. So or
Metro?
8 twice. Okay, so that's so then that would be okay. So this that would be 4.4 plus 4.4 is 8.8, right?
Yeah.
Per day.
Yeah.
And so then this dog's on this plus Unison plus Metro, which is a lot of it adds up for a little dog.
Mm-hmm.
Then, like a dingbat, I put her on, not badly, but I put her on insulin CRI because she was diabetic.
Was she that diabetic that she needed an insulin serum?
Well, it's interesting you say that. So people say, is she that diabetic? It's not the severity of the diabetes, you know. Like in our hospital, like the people say, oh, is it a DK, is it diabetic or is it DKA? I don't think it matters because what matters, I use the insulin CRI if they're not eating. As long as they're eating, I don't do that, but they could have,
Yeah,
in
let
other
me
words,
think about that for a
it's
second.
just,
Use insulin CRI if they're not eating.
so in other words, I
But
give
doesn't eating make their insulin go up?
okay, so yeah, so if they're not eating though, you still think about it, but dogs come in that haven't eaten in days and they're diabetic and their glucose is 500.
Okay, so that's not good.
Right, but so my thing is this, the only reason they're not eating is because, in other words, if they're eating, I can give them insulin roughly at the time that they're eating, or even if they're eating a little bit. But if they're not eating at all, then I want to make sure that their glucose just stays at a steady level. So there's 2 ways to manage diabetics. So if they're not, there's no, does that make sense? So I don't use.
So like for that Bubba cat whose
Uh-huh.
insulin was too high to read every time despite an insulin CRI, that would make sense that he's on insulin CRI. But for a dog that, if it like fluctuates, then I wouldn't think you would put it on insulin CRI because what if it gets too low?
Right, but that's why we have a sliding scale, exactly. Right, that's why we try to prevent that from happening by measuring their glucose every 4 hours, and so it stays.
Why not just give it insulin once or twice a day?
Good question, because what if you give it, because you can't take it away. If you give it twice a day insulin, let's just say you give it insulin and it lasts 10 hours. You can't go back and take it away. In other words, it's there. and you can compensate by adding more glucose, but it's risky. Does that make sense?
Mhm.
Because if you give them, you use regular insulin that lasts an hour, at best. And so if we for instance, we'd rather not overshoot. It's, in other words, if we're just going to give insulin twice a day, we're just, in other words, the dog's.
Wouldn't it mess with their, I don't know if
No,
like
okay.
their pancreas has like, not memory, but wouldn't it like overcompensate once you take it off the insulin CRI?
No, because that's good, because that's the whole, the beautiful part about CRI is it's a very short acting insulin, and so you're trying to, so you have a dog, and this is just a blood glucose is, okay, blood glucose. And if you have, the thing is this, if you have a dog that it's not eating, and let's say you give it 2 insulin injections here, like one here and one here, what you expect when you give insulin between it is, if you look at the glucose, ideally what happens when you give insulin here, there's their blood glucose, it's going to go like this. Does that make sense?
Mm-hmm.
You give it again.
Mm-hmm.
In an animal, that assumes that an animal is well. But if you
Yeah.
have an animal that has either Cushing's or pancreatitis or heart disease or kidney disease, this doesn't work. And so it's much more erratic. So what we do is, instead of giving it twice, and what we try to do with this is, we know that if they were eating, then I could just give them a little bit of insulin, and I'm not worried about getting too high or too low, because they're eating and I start them low.
Mm-hmm.
The CRI of insulin is to make sure that it stays steady, and it doesn't, and to
Even
avoid
if they're not eating, you put them on an insulin CRI?
that's when I do it, is when they're not eating, because your body still makes, the source of, in other words, think there are diabetic people and dogs that haven't eaten in days, but their glucose is still 500. And where's the glucose come from if it's not from food?
I don't know.
Where do you think?
Hang on, let me think.
What would happen to you? Okay, let's say that you are, where would you get nutrients from if you were like lost in the desert and just had access to a little bit of water?
Is ketones the right word?
Okay, so they're using a different energy source, exactly. So one way.
And that's
is
where you
to-
get ketoacidosis.
Yeah, so you're fat, and so, but ketones it's very normal. People have, if you didn't eat for a day, let's say you didn't eat for a whole day, and you peed on a dipstick, you probably have some ketones in your urine. But it's not bad, it's not a dangerous thing, necessarily. It's just, that's one of those, so your body breaks down muscle and fat. So that's why people who are lost in the desert, or who are lost on a desert island or whatever, and they find them, they're like a rack of bones. But their blood sugar is normal. But it's very inefficient, so your body breaks down fat and it can break down protein. But it usually preserves that for usually it breaks down protein last. So the reason that these dogs have the reason that their glucose is so high, okay.
So this is not really on the same topic, but kind of insulin. There's like different types of insulin, like long acting, short acting.
Mm-hmm.
How do you choose which one to put it off? You just pick one?
What you're trained with. So there's the short acting insulins. There's only one we really deal with. It's called regular insulin.
Yeah.
R. So insulin R, human R.
Mm-hmm.
There's another one that you can use called Lispro, Lispro. It's a short acting insulin. And then the long acting insulins that we use, it's very much doctor preference, what you train on. There's no right or wrong answer. So human R, or regular insulin, is short acting. But then we could never get something called regular insulin. They make something called Lispro, Lispro, which I've used when regular insulin was not available. Okay?
Okay.
But then if you want to give, once an animal starts eating, once an animal is more stable, and eating is what I use to transition them. So there's NPH, you've heard of that?
Yeah.
And then there is,
Like Lantus.
okay, so
Is that the once a day one?
I don't know that there's any really there's no once-a-day insulin. I've ever used it. We've tried for years to try it. Some animals can be very good. I think every animal in my hands that's diabetic has always been on twice-a-day there's NPH.
What is that, short acting?
No,
Or-
it's long acting.
Long. Long acting means how long?
So long acting means can be given twice a day, once or twice a day. So the other names for this are Humulin N. If you have to call this into a pharmacy, there's another one of these called this. Have you ever heard of? Sometimes we have it in hospital. Have you ever heard of it? It's called Novolin N.
Yeah.
So Humulin N and Novolin N are similar, but they're not the same. But if I'm calling it into a pharmacy, and the dog they say, oh, I don't have Humulin N, but I have Novolin N. They're not the same. But if you haven't started them on one yet, if it's the first time they're started, just make sure they stay on the same one.
Mm-hmm.
Then what are the others? So then you said Lantus. Okay. The other name, you know the other name for Lantus? I know you know it. It's just I don't know with Glargine. You ever heard
I
that?
never heard that.
So it's called Winston Glar gene, and has to do with what? So it has to do with it's a glycine and arginine are on insulin to make it last certain ones. That's a long-acting one. That's mostly in cats, but you can use it in dogs. Yeah. Then the other one that we have is Vetselin. You heard of that?
Yeah.
And so what's important about Vetselin? What's about giving it? Specifically with the syringes.
Oh, it's like a U40 syringe?
Okay, and so yes, so it's important. So these are all 100 units per mil. Vetselin is 40 units per mil, so you have to use a different syringe. And I have not. There are. Then there's the other insulin that is expensive but works for. And the only other one, so you know about it. I've used it in dogs. It's called Detamir. You ever heard of that?
Mm-hmm.
So, do you ever take organic chemistry? Hopefully you don't have to.
Yeah.
So you remember there's like right is Dexter and left is Levo, in a
Yeah.
sense. So Detamir, so the other name, so Detamir and the other name, there's also Levemir. So Detamir is like right the Dexter rotatory isotope, and like Levemir is the other one, whatever. But you know whatever it means there. So these are the ones that are they're all BID. And NPH, I don't know this is dogs. Cats are dogs, and dogs. So the only ones I've ever used in cats are these, and I've only used this and this in dogs. Now, back in the days when Dr. Pullen was my student, we didn't have all these things, and so he's probably a lot more fluid with the insulins. But does it make sense why we have to put the dogs on the animals that are on an insulin CRI? The reason we put them, the reason it's important to have insulin is so they don't break. So number one, there's two reasons to put them on insulin.
Okay.
One is, my goal when I have a diabetic, a sick diabetic. First of all, when people say, "Oh, is it a diabetic or is it a DKA?" It doesn't matter. And the reason it doesn't matter is, well, for me, this is a growing thing. Why doesn't it matter? Because they're a sick diabetic, and sick diabetics have ketones. Okay?
Mm-hmm.
But ketones, I hope you don't mind, like I'm talking directly at you.
No.
This is helpful or not. I'm just taking
No,
it
I
at it.
keep them.
So, for me, they're sick, and so if they're the reason, so ketones are acids, and so why do you have ketones? Well, your body does not have enough glucose substrate, so then your body breaks down fat, and it becomes ketones. Okay,
Mm-hmm.
and you can use ketones for energy.
So ketones are if you don't have enough.
Ketones are an alternate energy source.
Okay.
That your body can use instead of glucose.
Yes.
And it's from the breakdown of fat. So you've heard of people on the keto diet, right?
Yeah.
So my friend Travis lives every day of his life for the last 15 years with ketones in his urine. People are like, but the truth is there's no problem with that. In other words, ketones are not bad. Ketones are physiology. There's no evidence that having ketones in your urine damages your kidneys. Why? Because it's normal. ketoacidosis means that, so the ketones are acids, they're weak acids.
Mhm.
But it takes a while for them to overwhelm your body's capacity to buffer them. And so so if you have a lot of them, you become ketoacidotic. The reason I don't think it matters, personally, is because how do we treat acidosis? If not, what do we care?
Wait, hang on. Acidosis.
Right, so we don't, something we very rarely use. A drug that's, like, so what's it, so
Is it sodium bicarbonate?
It's a bicarbonate, exactly. So the reason that I would want to know, I have a sick diabetic, and if I was told it's a diabetic ketotic versus a DKA, so basically a sick diabetic is going to have ketones, okay? There are dogs and cats that come in that are on insulin, and maybe have a little bit of ketones in their urine. Ketones aren't bad. If they build up in excess, it's bad. So since there is no evidence in people or in animals that giving sodium bicarbonate has any meaning. It doesn't change their duration of hospitalization. It doesn't change their mortality. And so we don't use it. The treatment for treatment for acidosis, and this is going too far. The treatment for acidosis is treating the underlying disease, and we're treating it anyway. The bottom line, so the other thing to remember is that it takes very little insulin to get rid of ketones. So if the animals have just a little bit of insulin to process glucose, the ketones go away pretty fast. Does that make sense?
Mm-hmm.
And so so the ketoacidosis, they're usually sicker. I don't treat them different. Does that make sense?
Yeah, I mean, how would you treat them different?
I don't. The only treatment that would be different is if someone said, are you going to treat their acidosis? I don't.
It just gets better when you fix the underlying.
Correct, almost always. And there are conditions in people, and we have invented medicine, but none of them are critical. So none of them are critical diseases. So the animals that are acidotic that we see animals that have ketones. So you have too much ketones. You become acidotic because you have too much lactate. You become ketoacidotic because you're not excreting, because your kidneys aren't working. And so the only time that there are diseases, there are some diseases that instead of having too much acid, you have a disease of your kidneys where you're peeing out too much bicarb. And if you have a disease like that, it makes sense to replace bicarbonate. It does not make sense to replace bicarbonate in an animal who has a buildup of something else.
Yeah.
The key for me is to get rid of whatever the underlying thing is. And so I also don't, I think a lot of doctors, I've seen them do like twice a day measure ketones, like the ketones to see. I think it's a waste of money. Because I would send an animal home with ketones in its urine. So I don't check for that. Once they're eating.
And what if it's like a high amount of ketones?
So it doesn't, if the dog is eating.
It should fix itself.
Yeah,
eventually.
the other thing, if you're really curious, it's interesting, I'll tell you, there are some reasons why that happens, and so there are three ketones that we have measured. One is acetone, one is acetoacetate. And if this is too much, that's crap.
No, this is
the other one is
more
called,
memories from
the one is called beta hydroxybutyrate. Okay.
Mm-hmm.
So when you make them, in general, you have acetone goes to this and goes to this. Okay. So when you then treat the disease, you want it to go this way, right?
Mm-hmm.
This one is much more of a strong acid than this. So sometimes, if you measure their ketones, their pH doesn't change, because what happens is you're treating them, number one, but this is the only one that appears on your dipstick. So let's just say, so you could have an animal that you're treating. Does that make sense?
Yeah.
A positive.
Yeah.
So you make all this beta hydroxybutyrate, but but it doesn't really register on the ketone strips. But then you treat them. You're treating them. What happens is this goes this way, and this shows up on your ketone strips. You'd be like, oh, mild, mild, mild ketones, and you treat them like, oh my gosh, she's got a lot of ketones now. It's not because you do anything wrong, it's because this is the one the thing measures.
Mm-hmm.
So I don't care either if I don't even check them. Nor do you do it. I always ask myself, if I'm doing a test, what does it change? I would not keep an animal hospitalized for ketones. They're normal. They're not normal.
Well, that was kind of my question with Nicholas, because would you do anything different if, besides moving him into isolation, treating him different if he had parvo or not parvo?
No. That's why I think it is important from just touching other patients.
Yeah.
That's correct. He looks really good.
That's good.
He also got, for a dog as sick as he was from parvo, he got better really quick.
So do you think his housemates had parvo too? Is that a weird situation?
I think they're poorly managed. I think their hygiene is kind of the best. I don't know. I told you that. I don't. At gunpoint, I don't have an answer. But in his case, the reason with him, his is a good case to really highlight fluids, because he's on a ton of fluids. But if we only put him, let's just say someone said, oh, just put him on twice maintenance. He's now on 230 mils an hour. But the reason that I'm comfortable doing that is I felt that he was dehydrated and dry. But if we put that thing up his butt, so we're measuring his fecal output, you have urine output,
Mm-hmm.
plus his nasogastric tube.
Mm-hmm.
And if I add up what's in his urinary bag, his poop bag, and what's coming out of his stomach, that well exceeds the volume of twice maintenance fluid, so he'd become dehydrated. And the important thing to realize is if you go into his cage and 4 hours later you pull off 300 mils of fluid, let's just say from his stomach, right?
Mm-hmm.
Where's that coming from?
His stomach.
Mm-hmm.
What do you mean?
So the point being is that fluid, you're giving that IV, and it should be in his veins, right?
Mm-hmm.
Or getting processed. That his body is taking all that fluid and dumping it into his guts, so it's not available to him. That fluid, that 300 mils that's sitting in his stomach, it's fluid in his body, but it's nowhere it needs to be. So he's dehydrated. Does that make sense?
Yeah.
So that fluid should be in his veins, in his tissues.
Why is it going into his stomach?
So it's going to stomach for a few reasons. So he's making a ton so you make a lot of secretions, gastric secretions.
Yeah.
And so most of it is just from gastric fluid production, just from
I guess how is it getting there?
So water gets up. So how's it getting there? Because there are all these like fluid pumps in your GI tract that normally provide some lubrication, hydration, and nutrition for your guts. But and the key is this: is that normally the amount he's necessarily producing isn't bad, but it can't go anywhere. So typically, if you have some fluid production or there's fluid in your stomach for whatever reason, it goes down your intestinal tract, and water gets absorbed almost always distally. So it goes to your ileum. The water doesn't get absorbed much in your duodenum or your jejunum. It goes farther down, gets absorbed in your ileum and colon.
Oh.
And so there's nowhere for it to go. And so back like this, so we have to add those up. So his urinary losses plus his whatever he's putting in his stomach. The reason it's important for cleanliness, but it certainly highlights why we have him on such a high rate of fluids to keep up with that, and ideally to exceed that. But the thing is that if you have a patient like Zoe Jane, like I overdid her. Like she's 2 kids, and I had her on like so much fluid. So a dog like her, you can't use an insulin CRI in a 2 kilogram. This is a lesson I learned. We can't use an insulin CRI in a 2 kilogram dog. Because
this might be a stupid question, but like, what exactly do you like overload the kidneys, or what does it mean when you overload them with fluid? What is it overload?
So by overload, she can't handle. It's too much for her kidneys to get rid of. So the bottom line is, normally my goal would be to put her on, let's say, 10 mils an hour total.
Mm-hmm.
10 mils miles an hour, if her glucose is greater than 350, she's going to be on 10 mils an hour just of insulin alone without her fluids. Remember at 10,
Mhm.
8, so what I would do with a dog like that now is what is I either what I would do is I put more insulin in the bag and lower the rate.
Why does the rate have to be 10 mils an hour? Oh, because glucose is so high.
It's arbitrary. So the way that's just for dogs. So it's for the cats. So what I do is I make the whole thing. So basically, if your glucose is it's like greater than 350, 250 to 350, 150 to 250. So it's 10, roughly 8, 7, right? Then if it does that make sense? Remember that's so then you keep going up. But an animal the size of Zoe, I mean, she's the size of a grapefruit. You know, that dog was like this big. 10 mils an hour. That's exceeding probably what I would have wanted to give it alone. Makes sense. It's a lot of fluid.
But would putting it at a lower rate not touch anything? Like, would it not do
So
anything?
that's what I would do in the future.
Oh, just increase the concentration. of
Exactly.
insulin.
So instead, what I would consider doing, because usually I put 2.2 units per kg in a bag of fluids in a 250 ml bag, I might increase it and see what goes. I'd be punting. I would let's say 3 units per kg in a 250 ml bag, and then I would probably modify this like 6, 5, 4. Does that make sense? I would load. But you couldn't lower this without putting more glucose into the fluid. So I'd probably in the future do that. The other thing that we did, Veda cut out. What we did before this insulin CRI stuff is how else can we manage? If we don't have an insulin CRI, how else can we give insulin to a sick dog in the hospital? I've seen doctors do it.
Not just like with a syringe.
Yeah, so you can give it every 2 hours. I've seen that. So that's
I've never given iron.
regular insulin.
Yeah, I've never given iron.
Okay, because there's no difference. It's a doctor preference. So if I had a dog that came in as a sick diabetic dog, one thing to do is to put them on an insulin CRI. That makes sense.
Mm-hmm.
The other thing to do is we change the rate based on their blood sugar. The other thing you can do is give them, instead of insulin going IV, you can give them regular insulin, roughly like a quarter of a unit per kg every few hours, and it'll also keep their insulin relatively steady. There's actually there's no difference in animals whether they get better or not if you give them an injection, not IV. But yeah, you can give it every so often, to do the same thing. I think it's a lot easier to do it IV and just
Keep it constant.
It's also just less sticking the animal.
Yeah. So what do you think she like died from? Like too much?
I think she died. I mean, a couple of things. I think she probably had primary brain disease too. I couldn't tell because she was never really home.
Yeah.
But she had diabetes and pyelonephritis, and then in the course of her hospitalization, developed pancreatitis, which is bad. And so I think she just had too much she had too many diseases to address comfortably. And I think part of it is her size. We couldn't really get a hold of it. So this is the other thing. So what can we do for, like in a big dog, what's something, if I'm worried about giving an animal too much or too little fluids, you have an animal that weighs less than 8, 10 pounds. What's something that I ask the nurses to do?
Weigh.
Right. And it's hugely important on the same Frieden scale. Because if an animal that size gains 0.2 kg, that's 200 mils.
Mm-hmm.
Even if the scale is off a little bit, that's the best we have. And so I honestly don't know what I would have done differently with her. I personally would not have I would have adjusted her insulin.
What was her glucose reading at?
It would 3s and 400s and 200s. We were just adjusting her CRI as needed.
What was it when she presented? Do you remember? Like super high?
It was high. So yeah. So when you have animals that present, if an animal that has a glucose above 500, your body cannot do that.
Was she known that diabetic?
She's not. Neither was the other dog. Remember Paris?
Yes.
Those dogs came in back
Yes.
to back. She did good. She did well.
Did Paris go in?
Yeah, she did great.
Is that the one you put the bill? Paid her to go?
That's the one I paid part of her deposit because
She had a very sad story.
I agree, and I couldn't do it. Like I
You know, it's hard.
it's,
Yeah.
no, but I went 25 years without becoming that susceptible to that. But I just couldn't. I'm like, you know, I couldn't sleep at. I was after thinking to myself, how do I sleep best at night? And if I knew that situation, I don't have that kind of money laying around, but if it wasn't in my checkbook at the end of the month, it wouldn't change the next 6 months of my life. And so
Yeah. Well, at least the dog lived.
The
It
dog
wasn't for
lived.
nothing.
yeah,
It is time for me to go to work.
what time is it?
11:55.
All right. Well, anyway, I hope that was helpful.
Yeah.
Because I didn't have like a planned out lesson like
No,
last time.
that's fine. I like it.
Wow. So I have to ask Becky. Was this announced early enough that people could change this